1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now, here's your host, Paul White.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're glad you joined us. Before we begin, I'd like to thank our sponsor, Aultman Health System. Today, Brad and I are broadcasting from our administrative offices, and our special guest is Dr. John Elias, Medical Director of Aultman Now Urgent Care. Good morning and welcome to the show.
Morning.
All right. We'd like to remind our listeners that our program is available in our podcast. Just look for Health Matters with the Medicine Center Pharmacy in your favorite podcast app, and you can subscribe to our program anytime. Aultman Now Urgent Care treats non-life-threatening problems when your primary care physician is not available. Aultman Now Urgent Care Centers also offer full X-ray capabilities and several on-site lab test options for urgent care patients.
Sorry. Good morning, Dr. Elias again. Please tell us about your background and career with Aultman.
I started working with Aultman back in 2014. I initially graduated in family practice and practiced in rural Oregon. So I did a full spectrum. I did OB deliveries. We covered the emergency department, anything involved with rural care, full pediatrics, and adult care and hospital care. And then I taught at a residency program in Barberton for 14 years. And then I started urgent care initially down in New Philadelphia with Mercy, and then switched over to Aultman in 2014.
So where can we find information about your locations and hours of operations?
Yeah, the internet's always the best. There is an Aultman Anywhere app and that you can get in the App Store. And if you open it up, it really does a good job. I mean, this is you probably can't see this.
Okay.
You can't. I saw it was blurred, but it tells you all the locations. It tells you the hours. It tells you the days we're open. And there's even a place you could hit that'll tell you how to get onto our telehealth app. So, and we can talk about the telehealth if you want to later. But the app's probably the best. It has wait times. I can't guarantee they're the best wait times. It's hard to do that system. And, there is actually a little area you can click that'll tell you whether you should probably go to the emergency department versus an urgent care.
Okay.
It's a really good app.
Yeah.
Aultman Anywhere.
Awesome. It's always nice to be able to have that little bit of information when you need it in advance. I'm thinking back to a situation where I had a situation with my wife who fell and hurt herself. And when you're trying to figure out where to go, when you're trying to be responsible and use urgent care over the ER, sometimes it's hard to know where those hours are and times. So it's good to know that that app can help you with that. So in the pharmacy, we've certainly seen a lot of respiratory illnesses, whether it's COVID, flu, or RSV making the rounds. I'm sure you've got some comments on what you guys are seeing at Aultman Now Urgent Care. Can you share with the public what you're seeing and maybe even a couple tips on how to protect yourself?
So, yes, we're seeing all of them, all of the above. I'd say right now we're getting into peak influenza A time. We haven't seen influenza B. We're seeing a good amount of RSV and a good amount of COVID still. And we're also seeing a GI bug called norovirus. So those four seem to be the most common we see. And, if you're around people, you're going to be at increased risk of catching these illnesses. So just be aware. I would suggest if somebody's coughing, sneezing, it probably would be good to wear a mask just to protect the spray when you cough. But hand washing by far is the most important thing to do. And we mainly will contract these a lot of times by touching a surface and rubbing our eye or rubbing our nose. So good hand washing, good hand hygiene, and avoiding, if you're ill, especially if you're ill with a fever, you should stay home. It doesn't matter whether it's coronavirus versus influenza. If you got a fever, stay home.
Go ahead, Brad.
Good deal. So, based on all that, I guess I wonder if you could touch a little bit. You mentioned it in the app, but how can people decide when they should go to the urgent care versus making a visit to the emergency department?
So, the urgent care can take care of most of the acute illnesses, meaning things that just are happening. Most respiratory illnesses, lacerations that require repair, or fractures of your hand, your wrist, your ankle. If you have what you think is a stomach flu, but it's worse than normal, something with your ear, foreign bodies, splinter, something in your eye. The emergency department is important to think about. If it's serious enough, you might have to go to the hospital. You probably should go to the hospital. Strokes, heart attacks, any significant abdominal pain that might need blood work. We do some testing, but we don't do any type of extensive blood work or any imaging like a CT. If it's not a simple x-ray, we won't do it. If you think it's a hip fracture, if it's a big bone, you should go in to the emergency room. Head injuries of any severity. If somebody got a small one and you want to know whether they need any further care or CT, come by. We'll give you our opinion on it. And psychiatric emergencies are much better taken care of at the emergency department.
Jeez. So when people decide to go to the urgent care or the emergency department, what can they expect when they arrive? Are the check-in processes different?
They're similar. You check in, they'll get you registered, and the main difference is the emergency departments, they do a full triage. Depending on how serious you are, they're going to have a set of criteria which would tell them to bring you back sooner than later. We see people pretty much on a first come, first served basis. The only triage we do, if we see somebody that we think probably is going to have to go, somebody comes in and says, I've been having this, I think something's wrong with my heart, or it's been racing, or I'm having some chest pressure along with this cold and it's getting severe. We're going to bring them back right away. But mainly that's to decide, hey, do we need to call an ambulance, etc. So it's similar. You get registered. We see a first come, first serve at the ED or at the urgent care, as long as it's not serious. The emergency department is going to have a triage system, and they're going to do things as far as getting you in based entirely on what you came in for.
Explain triage. What does that mean?
Well, if somebody comes in and they have chest pain, they're going to be bringing them back sooner because if it's a heart attack, you want to be initiating therapy immediately. But let's say it's a 10-year-old who's been coughing and says they have chest pain. Well, maybe that's a bronchitis. Somebody with a cut on their hand versus a deep cut that's bleeding severely. So triage is basically looking at the condition of the patient and deciding this one needs to be seen right away. This one can wait, but not too long, maybe an hour or so. And this one can wait longer. Now they're going to get you seen with the longer. They're not going to always keep you waiting, but they decide on care is decided upon on how critical your condition is.
Okay. Our first break is here. You are listening to Health Matters with the Medicine Center Pharmacy.
Are you tired of paying hundreds of dollars to find out your thyroid, A1C, cholesterol, and vitamin levels? You don't have to anymore. Schedule your low-cost lab test at the Medicine Center Pharmacy. You can get your A1C, thyroid, and vitamin D lipid profile, which includes your cholesterol levels as well as glucose results. Test results in just minutes, and you can share them with your provider. Call the pharmacy or schedule online at midshoprx.com. Medicine Center Pharmacy with locations in Canton, Louisville, Minerva, and New Philadelphia. Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off and Out by store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off and Out by store in Louisville, next to the Medicine Center Pharmacy. The Medicine Center Pharmacies are now offering a service to help support your medication needs. We want to make sure that you have the medications you need when you need them. We will contact you 5 to 7 days in advance of your next medication refill to start the process each month. We will review your medications with you. We will contact your physician to initiate the process for refills and schedule a convenient day for pickup or home delivery. We simplify medication pickup into fewer pickups each month at the Medicine Center Pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off and Out by store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off and Out by store in Louisville, next to the Medicine Center Pharmacy. Have you ever gone to the pharmacy and decided not to fill a prescription because of the price? This is pharmacist Paul White. If you have skipped filling a prescription or a dose because of the price, we have great news for you. We are introducing a new membership program with wholesale pricing on every generic medication. Memberships are $5 a month. For many of our customers, our wholesale pricing is even less than their copay. Visit our website, midshoprx.com, and use our price checker to find out the price of your medication. Great deals at Medicine Center Pharmacy.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now, here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. Are you ready for vaccine season? Stop in or schedule your flu, pneumonia, COVID, or shingles vaccine online at medicineshoprx.com. So, Doctor, what about telehealth visits? Now, we've had a few of our staff have used this service and they were satisfied with it. So can people do a virtual visit when the urgent cares are closed?
Absolutely. So Aultman Anywhere will steer you to how to, to obtain the app, but you can find it, I think, on a Play Store or an Apple Store. Aultman Now app for telehealth. And that 24/7, you can have somebody available for you. They can do the telehealth. It's obviously good to be able to see things too. There's certain things you can look, they can look at a rash. They can, obviously if it's more severe and you need to have a fever check or someone listening to your lungs, they can't treat that. But many times you can get a good idea of what's going on and you can send a prescription to the pharmacy. So that is available. And again, it's an app. And I think we're all pretty accustomed to using those.
Very darn interesting.
Can you talk about how important it is for patients to have a primary care physician?
Yeah, I mean, we are just like Band-Aids when something, someone's gets an injury or they're sick and they can't get in. And I mean, there's primary care physicians, it's hard to get in. There's a shortage of them most of the time, but that is how you keep from getting sick. I mean, it's obviously doesn't protect you from everything, but the preventive testing, treating you for diseases that may not bother you now, like a hypertension, or you might not even know you have mild diabetes, but if you don't treat it, the long-term consequences are very severe for your health and longevity, and that includes some of the preventive, immunizations given at the doctor office or at the pharmacies. Um, all those are helpful. So when we see somebody frequently, they need somebody to go to make sure it's getting better, to verify, they don't need any further testing, or maybe they need further testing. We say, I think it's a stomach flu, but if it starts doing this and that, maybe you might need an evaluation for a gallbladder. And following up with your doctor is the best way. So you absolutely need to have.
I'm often amazed at the questions we get in the pharmacy because we often do our own version of triaging when people come in and they're looking for kind of advice on what to do. And so many are like, especially the younger population, they're like, oh, I'm healthy. I don't need a doctor. I just go to the urgent care. And I mean, nothing against the great service you provide at Aultman now, urgent care. But I think it is important, everything you just said. I mean, you don't know you have high blood pressure until somebody checks it sometimes.
Right.
So, I'm quite sure Aultman has a resource that if you need a primary care physician, you can probably call and they can direct you in the right direction. Thinking of all the Aultman medical groups that are there, but just something to think about, be proactive rather than reactive, I guess is where I'm thinking.
Yeah.
So now that basically flu season's here, we had, in the last week, we've had some of our first prescriptions for Tamiflu in the pharmacy. It's kind of taken this long. So, flu season's here now. And can you talk about the differences in symptoms between what everyone calls the flu versus the stomach flu and COVID also and common cold?
Yeah. So common cold is not really a specific virus that causes it. It is a mild viral respiratory. So nasal congestion, sore throat, cough, maybe a little bit of aching, and maybe a fever. An adult, maybe not, and a kid, maybe, maybe. And it might last. The worst of it's usually over by 5 days, although it can certainly string on to a week and a half or so with some symptoms. The flu and COVID, and to some extent RSV, can be similar. And if you get a mild case, it might be called a cold if no one does a test. But those are very specific. We're testing for COVID. We're testing for flu. I mean, you can go to the pharmacy now and they have tests for influenza and COVID combination. There are treatments not for RSV, but for flu and COVID. If you fit into the right criteria for requiring them, we have antivirals for them. But you're more sick. Everything about the cold, but I'll tell you, flu. It is a sudden onset. It is frequently a high fever. Adults don't get 103 fevers very often. They certainly might with influenza. Severe headache, severe aching, along with the cough, the sore throat, and other symptoms. So if it's severe, that's probably when you want to go sooner to the, urgent care or your doctor, because if we're going to initiate treatment, we have to do it early on. If it's mild, let it simmer, give it a week and a half to get better, unless something's getting worse. The stomach flus, and a lot of people think that is a flu. It's actually called viral gastroenteritis. That's predominantly nausea, vomiting, diarrhea. Some of the viruses can do both, like coronavirus can give you GI symptoms, but mostly it's respiratory. And you can get achiness and fever also. So that is not the flu when you have the gastrointestinal nausea, vomiting, diarrhea. That's generally another virus, and norovirus happens to be the one going around right now.
Okay.
The cruise ship virus.
Oh, so that's what everybody's bringing home on their vacation.
Yes.
Interesting.
All right. So can you talk about what are some common treatments that you can do? And, you've already mentioned when you need to think about going to see urgent care or your primary physician. When can you kind of self-medicate responsibly, and when do you need to kind of make sure that you're getting extra help if you've got a problem with cold, flu, or COVID?
Well, if it's the mild symptoms, I expect your nose to be congested, sore throat. I'm not, if it goes on a week, that's still in the normal realm. If you don't have a high fever, you're not having any significant difficulty breathing, you want to use the symptomatic care, and that, nasal saline flush, neti pot, some of the menthol, you can use Vicks. That's where, depending on your age group, you can go with a decongestant, such as, I recommend pseudoephedrine, which is, you actually have to sign for it at the pharmacy more than phenylephrine, because the studies show that is basically the effective one, and that's for nasal congestion. Cough, you could use the Robitussin with dextromethorphan. You can use you could use honey. That's another good one we use. And then we prescribe something called benzonatate. There's always prescription medicine, but that's when you see the doctor. So we're talking about the symptomatic. If it's more severe, if it's sudden onset, the high fever, the ache, you may want to get checked out, especially if you're high risk, if you're older, real young, real old, have asthma, heart conditions, anything that would make a flu more likely to put you in the hospital. You need to get in right away to be tested and put on Tamiflu or one of the other antivirals. There are others, but usually Tamiflu is what we use.
Yeah.
When are antibiotics appropriate to use in respiratory infections?
Yeah, and that's a big one. We see people a lot. They get very disappointed when we tell them about symptomatic care, but antibiotics really should only be used for specific problems. So things like influenza, common cold, bronchitis, which is like a chest cold, antibiotics are ineffective for those. So we want to use it for ear infections, strep throat, pneumonia, and sinusitis that's bacterial. So that's not when your nose gets clogged up for the first week, when you get a head cold. That is when it persists for longer than that, a week and a half. Or if it starts to get better and gets worse, that's when you go with the antibiotics. So those four things, strep, otitis media, pneumonia, and sinusitis, are what we want the antibiotics for.
Is there a risk to using antibiotics?
Yeah, there's a couple. So a direct risk would be you got an allergic reaction. You can get diarrhea from these because they kill friendly bacteria. The worst case scenario, and we do see it sometimes, is called C. diff colitis, and that can be life-threatening. And secondary things like thrush in the mouth or yeast infections are more predominant with antibiotics. On a community basis, we're having resistance problems. Antibiotics that we used to use a lot have a lot of issues with not working anymore. Some of our great antibiotics of the past, like azithromycin for pneumonia, is not effective like it used to be. And it's because we overuse them. So if we keep overusing on a community basis, they're not going to work anymore. So antibiotic stewardship is important. And as a provider, I got to be honest, we try to help the people by saying this won't help you. And they're not always happy with us. We get a complaint, that's usually what
so, yeah, doctor, I'm here. I want an antibiotic. Give it to me.
Yeah. And sometimes it's been a day or something.
Yeah.
All right. I think it's time for the news break.
It's pretty close. Okay. It is the bottom of the hour, and it is time for the news break, and we will be back in a few minutes.
Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off and Out by store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off and Out by store in Louisville, next to the Medicine Center Pharmacy. The Medicine Center pharmacies are now offering a service to help support your medication needs. We want to make sure that you have the medications you need when you need them. We will contact you 5 to 7 days in advance of your next medication refill to start the process each month. We will review your medications with you. We will contact your physician to initiate the process for refills and schedule a convenient day for pickup or home delivery. We simplify medication pickup into fewer pickups each month at the Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Are you frustrated with the cost of prescription drugs? By now you know that your insurance price isn't always the best price on your medication. The new Health Matters Drug Savings Plan is simple, easy way to save money at your local Medicine Center pharmacy. No need to visit a website or disclose your private information, fumble with your smartphone, or print out coupons. Just talk to one of our friendly staff members and ask for the best price. Medicine Center Pharmacy with locations in Canton, Louisville, Minerva, and New Philadelphia, and online at medshoprx.com.
WHBC AM 10, reliable as ever on News Talk 1480 WHBC.
From the News Talk 1480 WHBC newsroom, state leaders say suicide rates have decreased for the first time in 2 years. 1,777 people died by suicide in Ohio. That number is less than a 1% decrease, but the director of Mental Health and Addiction Services says it's a good sign that all the recent initiatives put into place are working. A Republican who ran for U.S. Senate in 2022 is now in the state Senate. Jane Timken will represent her Canton area district in a seat that's been open since the passing of State Senator Kirk Schuring. Schuring died in November. He served more than 3 decades in the General Assembly. Timken, whose husband is the former CEO of Timken Steel and founded a firm that lobbies federal and state government, serves as the Republican National Committee woman for Ohio. She's held that position since April of 2024. Con artists are trying to take advantage of people during the cold winter months. People all across the country reporting getting calls from someone claiming to be from their power company, threatening to turn off their power if they don't follow instructions. Better Business Bureau says these types of unsolicited calls are almost always a scam. In sports, coming up tonight on 1480 WHBC, it will be the Cleveland Cavaliers as they take on the Philadelphia 76ers. The tip-off is set for 7 o'clock. I'm Pam Cook.
Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off and Out by store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off and Out by store in Louisville, next to the Medicine Center Pharmacy. Have you ever gone to the pharmacy and decided not to fill a prescription because of the price? This is pharmacist Paul White. If you have skipped filling a prescription or a dose because of the price, we have great news for you. We are introducing a new membership program with wholesale pricing on every generic medication. Memberships are $5 a month. For many of our customers, our wholesale pricing is even less than their copay. Visit our website, medshoprx.com, and use our price checker to find out the price of your medication. Great deals at Medicine Center Pharmacy.
Your severe weather station, News Talk 1480 WHBC.
Here's a look at your AccuWeather forecast. We might have started out the day with a little bit of light snow, but then the rest of it's going to be cloudy at 20 degrees. Tonight, partly cloudy, dipping down just below the double digits at 9 above. And then we're cloudy tomorrow, 32. Same thing Sunday, 29. You can always get the latest weather news and forecasts when and how you want, wherever you are. Download our free AccuWeather app. This is meteorologist Jeff Nordine for News Talk 1480 WHBC.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now, here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. I am your host and pharmacist, Paul White. This morning, we're talking with Dr. John Elias. Can I make a point here, Dr. Elias? One of my family members was treated at the Washington Square, I think that's where it is, individual plan in a place that Aultman operates. I am absolutely blown away as what those places can do. I have never had a reason to use one of those, but this individual was diagnosed with pneumonia, and I couldn't believe all of the available tests and testing that is available at that individual place. And I assume that all of the Aultman facilities have the same amount of equipment and can run the same amount of tests, because this individual was very, very sick. And the individual who, wasn't a physician, but it was either an assistant physician or other sort of person.
Yeah.
But the treatment that she was given was absolutely fantastic. And I can't believe that you have all kinds of X-ray equipment and all kinds of other equipment in those facilities. It makes me think, gee, why did I go to the emergency room some time ago? Okay. So I think the lady that treated her ought to be championed. She was tremendous. I do not know her name, but the individual that cared for a relative of mine was sensational, to say the least.
Wow.
So,
That's great. That is great to hear. Yeah, I mean, uh, I'm glad when we do a good job. We basically have everything available at all the sites. We try and keep them the same. Washington Square, the only thing they do that other places don't is because they're by Walsh University. We give some immunizations that we normally would, that maybe a primary care would, because at Walsh University, they're they're not by their primary care. And, we'll do TB screening, which we don't do the other parts. But all the other type of treatments we can do at those places. And yes, we do see life-threatening illnesses there sometimes. And if we catch them early, they don't have to go to the hospital. We treat them. And pneumonia, we've seen several of them. And there's a criteria of when they have to go to the hospital, but if they're appropriate to treat outpatient, we get them set up.
the person that treated my relative might have saved her life because she really was in bad shape with pneumonia. So that woman needs to be congratulated. So please
Well,
do
if I
that.
could find out whom, we will do it. I appreciate you giving me that feedback.
It's just wonderful what she did. So go ahead, Brian.
All right, so we've talked a little bit about respiratory conditions since that seems to be a big topic going around. Did we cover effectively before the commercial break when you should seek treatment if you're having trouble with a respiratory condition?
I think so.
Okay. And I guess that being said, let's debunk some myths then. I was out shoveling snow this morning before I came to work, and does cold weather cause colds?
Yeah, so it doesn't. Like when I first heard about it, they told us about a study done amongst medical students who will do anything to get a little bit of pizza money, and they basically studied whether being in a cold environment would make them get ill, and they kept them cold for prolonged periods of time, and it never happened. I mean, it is from a virus. There's a cyclic nature, especially to influenza, um, uh, less so with COVID and regular colds, that we don't not totally understand. But I will tell you something, it's always during the winter. So yes, that does come out and make you wonder, but let's think of the other things. School's in session. As soon as school is in session, we see a ton of this. So there's a bunch of kids who are not the best at hygiene congregated together. And then, when are our main holidays where families get together, airports get busy? It's the wintertime. When do people stay inside and shop and stay? I mean, hardly anybody's been going out in the past week. They're not getting out. They're not going to the park. So when people congregate, that's when you seem to see it. So I think that's the best explanation to why people do, in fact, get more sick during the cold weather. Although warm weather, we still see plenty of colds. That's still it might be 30% of what we see or 20%. That's still the most common single problem we see in the middle of the summer. So.
Interesting. Go ahead, Brian.
All right. Well, respiratory illnesses are not the only thing that you see during cold weather. So what types of injuries are you seeing that urgent cares in the urgent cares and emergency department?
Well, falls, that's probably the biggest one we see. When there's ice out, we obviously are doing a lot of x-rays. And, you have to be smart with that. If you're going out and it's going to be an occasion and you want to have some stylish heels or some nice shoes, bring them with you, put them in the car, and wear some kind of boots with traction on them. I literally, for ice fishing, there's these little rubber things you can put on that grips. So that's what I walk my dog in, and you have to be situationally aware, look and see where the ice is. If it's around your house, get some salt down. I know that it makes a mess inside the house, but do that. And don't have your hands full. I mean, if you got a purse, put it on your shoulder, because if you're going to start to fall, you need to be able to grab onto something. If you got things in your hands, much higher risk of falling. And for elderly people, don't skip using an assisted device because you feel you might look old because of it. Get your cane. That will help you in these instances.
I see kids waiting for the school bus in Crocs and and no boots and no gloves, and some of them not even a coat. And I'm thinking, what in the heck are you thinking? You got to be cold. So automatic fall, sickness, whatever, right there. So.
And I can talk about a couple other things. You talked about snow shoveling, right?
Yeah.
And that is a risk for heart attack. And if you're at a high risk, you need to be careful. A little bit of advice. So when you get outside, your blood vessels constrict and your heart needs more oxygen. So you're already set up. A lot of times people, right when they get up in the morning, want to shovel, and at that point you have a higher risk of heart attack anyways, because there's these things called catecholamines, which are high. Heart attacks are higher. So if you have to and you can't get anybody else to do it, then get up, eat your breakfast, relax, then go out, do it in short spurts. Stay warm so you don't get as much constriction, and push the snow. Don't lift as much.
Don't lift it, right? Correct. So many people are out there shoveling and picking it up with a big shovel load of snow, and I'm thinking, come on.
It's unfortunately it's a high, gets to be a high risk for a heart attack.
Interesting. You think winter's over yet, Doctor?
We've had so many different ones. Usually we get a blast again in February, but last year we didn't have much. This year reminds me of the late 70s, early 80s.
Yep.
We used to have it all the time,
Yep.
When you're talking about the people, they're wearing the Crocs and the shorts. I mean, luckily they could go down to their house right down the road, but it's really not a wise thing to do, to go out in cold weather when you might have a car breakdown or a car accident. You need to. In my car, I have a little short shovel. I have backup boots, hats. But when you go outside, you got to be aware because of the cold weather injuries. So the last thing I could talk about would be like a frostbite type of thing. But that of all weather-related fatalities, excessive heat, hurricanes, tornadoes, 2/3 are from excessive cold. And of that, 60% of them are related to excessive cold with alcohol. So alcohol is a vasodilator. It's not an antifreeze. It makes you at much higher risk of losing heat. And you got to be very careful with that. And you got to dress appropriately. Good boots, You want to not wear tight clothing when you go outside. You want to wear layers. And the first layer should be wicking. The second layer should be more of a wool. And the third layer should be more water resistant, because if you get wet, that's where you start losing the heat. And even conduction. You can get frostbite on your hand by touching metal just within a couple minutes is the issues. So
have you seen any frostbite this year?
I haven't seen any frostbite yet. I mean, the emergency department does, and predominantly it's elderly people, but it can also be children. Their body surface area can lose the heat. If you lose it in your core, you're going to especially lose it to your face and extremities. And, most of the time it's frost nip, which is like frostbite. If we've ever had this before, you go outside, you get, your fingers turn white, you can't feel anything, they get numb, and then they start to thaw a little bit, and you get that horrible aching that lasts about 15 minutes. That's frost nip, because if there's no damage to the tissue, then that was what's called frost nip. Frostbite, there's 3 grades to it, and the treatment of it can be anywhere from observe and take ibuprofen to, there's, for bad type of frostbite, you need to go to the hospital. You need to have testing done for your circulations. They literally use some of the thrombolytics like they do for heart attacks, like TPA, to try and open up blood vessels in some people with severe cases of it. And it can be quite severe.
Jeez. Okay, I think our final break is here. You're listening to Health Matters with the Medicine Center Pharmacy.
Are you frustrated with the cost of prescription drugs? By now, you know that your insurance price isn't always the best price on your medication. The new Health Matters drug plan is a simple, easy way to save money at your local Medicine Center Pharmacy. No need to visit GoodRx or Single Care, disclose your private information, or print out coupons. Just talk to one of our friendly staff members and ask for the best price. It is that easy. Medicine Center Pharmacy with locations in Canton, Louisville, Minerva, and New Philadelphia, and online at medshoprx.com. Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off and Out by store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off and Out by store in Louisville, next to the Medicine Center Pharmacy. Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off and Out by store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off and Out by store in Louisville, next to the Medicine Center Pharmacy. The Medicine Center Pharmacies are now offering a service to help support your medication needs. We want to make sure that you have the medications you need when you need them. We will contact you 5 to 7 days in advance of your next medication refill to start the process each month. We will review your medications with you. We will contact your physician to initiate the process for refills and schedule a convenient day for pickup or home delivery. We simplify medication pickup into fewer pickups each month at the Medicine Center Pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Have you ever gone to the pharmacy and decided not to fill a prescription because of the price? This is pharmacist Paul White. If you have skipped filling a prescription or a dose because of the price, we have great news for you. We are introducing a new membership program with wholesale pricing on every generic medication. Memberships are $5 a month. For many of our customers, our wholesale pricing is even less than their copay. Visit our website, medshoprx.com, and use our price checker to find out the price of your medication. Great deals at Medicine Center Pharmacy.
Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now, here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. I am your pharmacist, Paul White. Thank you for joining us. Let's get back to the last segment of the show. So, respiratory illnesses are not the only thing that cold weather could bring. What types of injuries are you seeing at the urgent care places and emergency departments? Are a lot of people falling on the ice, or what's going on?
Oh yeah, we're seeing we see a lot of fractures, and that's one of the issues as far as we had talked about trying to avoid the falls and so forth. And just the cold itself. This is excessive cold. So we talked about covering, but I forgot to mention, covering your face from these issues. And if somebody gets excessive cold, what do you do for it? That part I didn't get to. One of the things is if there's your feet feel like they maybe and have frostbite, you don't ever want to try and warm them if there's any chance they could get refrozen, because that will significantly damage that body part. So only rewarm when you can get the rest of them rewarmed, when you can stay in an environment that will keep them warm. Usually people will ask, what do I do for my, frostbite in the hands? How do I rewarm it? You don't want to use a dry radiant heater. You want warm water usually. So body temperature water around 100 degrees, put your hands and feet into that and kind of circle it around a little bit. That's the best way to treat that. And if you're wet in any way, somebody's shivering, they're cold, they're wet, get the wet clothing off as soon as possible and give them some hot beverage. And that is one of the best ways that we can avoid that. And there's the trauma from falling, there's head injuries that you have to be careful about. And again, most head injuries, especially if you're elderly or on a blood thinner, you would want to go probably to the emergency room if you want our opinion on the head injury. But, you always want to make sure you get a CT scan, because we can't really tell, especially in the elderly people on blood thinners, if there's a small bleed. That one needs to be seen. But remember, there are some other emergency departments that are like 24-hour. We have one over in the Maslin-Jackson area that's not attached to the hospital, but they can do things like CT scans and more significant blood testing. So,
well, I think we've kind of covered this next question, is what we can do. What can we do to prevent cold weather injuries such as slips and falls? I mean, there's so many people that are careless in getting out of their, jumping out of their car, or I see people run up and down West Tuscan. I'm thinking, what are you doing? Because it's icy. And then I see people walking out in the street, and because the sidewalks are not all plowed out, and I'm thinking, come on, it's careless. So anyway, health risks in shoveling snow, we've also covered that, I believe, too. Don't lift the snow up. And I see so many people shoveling and they lift it up and throw it over their shoulder. And I think, oh my gosh, you're gonna wreck your right arm or left arm or hand or whatever. So it's just interesting. So
yeah, if you were a school athlete and want to, get your workout that way, I guess, but not for your everyday person who may be at risk for heart issues.
yeah. I caution every customer and when they leave the store, please be careful. We try to do the best to keep our lots clean, sidewalks clean, and all that. But the way the snow's been falling down every other day, it's almost impossible. So to do that. Go ahead, Brad.
So, Doctor, do you have any parting words to share with listeners to try to make the best of the cold and flu season that's upon us?
Oh yeah, I mean, I would never discourage anybody from getting together for family events and enjoying the snow, going skiing, etc. But be careful. Have the cold weather gear available in your car. You don't know if you're going to get a breakdown. As far as illness goes, if you have a fever, don't go out. I mean, even if you feel like, my work needs me, your work doesn't need you that bad. You may bring this influenza to everybody at work, and then they will be in trouble. So if you're ill, take care of yourself, drink liquids, control the fever, use the symptomatic care, and come see us if the illness is, severe enough or has gone on long enough that you need, you're worried that it could be something else other than a common cold. And you can do some testing yourself. Like I said, at the pharmacy, you can get the rapid influenza and COVID testing done at the same time. So enjoy yourselves. Be careful. Dress smart. If you have an illness, if you feel like you need to be seen, be seen. As a medical provider, just it is tough on us. I'm just going to say that during this season, sometimes we are very busy some days, and we don't know what days are going to be. If you go in, you see a full waiting room. We're trying our best, and if you waited and the doctor says, yeah, this is a viral illness, an antibiotic won't help, please try to understand, we're not doing this. It's the easiest thing I can do is give an antibiotic for any cold there is, and everybody walks out. But if I potentially may harm them, I'm not doing a good job as a doctor. And it's important to try to do the best and try to be understanding. We'll keep an open ear for your complaints, but sometimes you got to wait a little bit at this time of year.
Okay. Doctor, can you remind our listeners where the Aultman Now locations are?
So Washington Square, we have one in Louisville, right across from the Dunkin' Donuts.
Yeah, that's rocking, that one.
Yeah, I got that. And then we have one in Jackson. It's a little bit down, I believe that's Fulton, a little bit east of where the crossing is right there on the Maslin Road. It's right by the Jersey Mike's.
Okay.
I realize that I always talk about food, but that's where my mind goes. And the main one is on Whipple and Dressler.
Okay. Right.
And that facility has physical therapy, etc., cardiac rehab, orthopedic surgery. We have a surgery center there. Louisville also has other draw stations therapy.
All right.
And primary.
Okay. Thank you very much to our guest, Dr. John Elias. If you suspect you have a medical issue, please contact your healthcare provider. Thanks to Aultman Health System and our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you right here again on Friday, News Talk 1480 WHBC. And doctor, that lady's name was Karen that treated my daughter Joy.
All right. I know exactly who you're.
I think she deserves an award.
Okay. I know exactly who her is. I love her.
Yeah. Okay. Thank you very much.
Thank you, Doctor.